Yeah, thank you, Ayan. Hi, everyone. This is Vian Daher, Mail Manager from SCI Iraq, based in Erbil country office. My session will more focus on two topics that I noticed in Iraq country office and how we were able to solve these challenges and make sure that we are following the right procedure to address the challenges that we have in accessing the CRM mechanism, mainly by children, and how children are participating, and making sure that the challenges that raised by children are addressed. Next, Anne. I will take you into two practical or two case studies from Iraq country office. As I said, on the child participation in accountability mechanism or CRM mechanism, as well as the information sharing, remote monitoring, and also, remote monitoring, and also information sharing with beneficiaries. Next. The first example that I will show from Iraq country office is about one of the field offices where we had, I will say, zero complaints from children in the last couple of years. We always try to solve this challenge, and we've done by ourselves. I mean, the mail team have done several sessions with children, but these sessions were not happening on regular basis because we did not have the enough human resource capacity to run these sessions on regular basis, or at least on monthly basis. What we came up with, we have decided to address this challenge through the current through our current facilitators that are facilitating the sessions in our centers. The first step that we have done is training the facilitators on the accountability mechanisms and the tools that we have, and the forms that they should be filled by the children. The second step that we have done after the training, the facilitation of the training, was ensuring that the on daily basis, the facilitators have to give session to children and explain to them the accountability mechanism. So it became a mandatory item or a mandatory task that should be done by the facilitator to make sure that we receive the complaints and the feedbacks for sure from the children. The last thing that the third step that we have taken is we had to also making sure that the accountability mechanism popularized among the children themselves, and they had to do these sessions for other colleagues or for other children who were not able to enter our centers. One of the things that we have noticed during that process, and as you see on the screen, that in 20 and 21, we had only 30 feedback. But within the last month, August 2022, we have received 57 feedback or complaints from children under one project. So I will say there is a huge difference and a huge improvement in terms of the number of the feedback that we had to receive from children, which was not the practice in the previous years. What we also done through that process, we also printed out business cards beside the training or the orientation that we have given to children. We have also printed out a business cards with and we had handed over to children themselves. And on these business cards, we have explained to children the availability, the types of the mechanisms that we have, in which case they should reach out to Save the Children, and what type of concerns or feedback they can raise to us. So as you can see also in the screen, that these are few feedbacks that we were able to receive during the last month. We have seen that children saying that why the older children or the children who have participated in youth resilience have received the recreational activity, recreational items that, but they were not able. They were started asking about the times of the session. They also have been also as I said, they were also asking why they have not received the gift. So this type of event, maybe it can be a very small types of feedback. We've not been receiving such feedback from children at all. And throughout, as I said, throughout these sessions, we made this applicable and we started receiving these types of feedback. Next. The second thing that I want also to present is the using the technology and accountability mechanism, and how the technology helped Iraq Country Office to increase the information sharing with beneficiaries, children, mainly children, also receiving the feedback from children, as well as also doing a remote monitoring in areas where Save the Children does not have access due to security or any other challenge that we may face within the country. Next. So this is the types of the feedbacks I just explained in the first two slides that we received them from children. So you can see they are also written in a small papers, but these are types of the feedbacks that we were able to receive during the August 2022. Next. Yeah. So this is the technology or the mobile phone application that been designed internally by Save the Children male person, and it also we started I will say started piloting the application in our targeted location. So the application has a few types of pillars, or three types of pillars that we will I will try to explain. One of the things that this application is taken into consideration, the language barrier that we face usually in responding to the hotlines or complaints that we receive through our hotline system. So we made this application in both languages, Kurdish and English and Arabic, and we are also in the process of having additional language, which is the Kurdish one. The application is trying to explain for people who want to know, rather than calling us on the hotline, they will also having an information on the types of services that Save the Children is providing, the areas where Save the Children is working, the available mechanisms, and as well as the implementation sites, and what kind of services that we can provide. As well as also a brief about Save the Children, these SCI values, missions, and and what we are and what we're doing, as I said. Next slide. So these are pictures that I took through our phones. The application is available on Android, and it can be downloaded on Android and iOS as well. So as I said, it gives information about the monitoring and evaluation, the accountability mechanism, the remote monitoring. So the child or the adult can take a picture and also explain and do the monitoring on our behalf. And it can be both things. It can be a monitoring, or also maybe raising a concern or feedback through the remote monitoring. As I said, we are also explaining who we are, the thematic areas that we are having. We usually receive a feedback from children requesting for health services, which is something that we don't provide in Save the Children ERA country office. So the thematic areas will explain to children as well as adults what kind of services or thematic areas that we can support with, and the types of the activities exactly. So the activities and sub-activities. In this case, maybe they don't need to reach out in case they have seen the thematic areas that we support. As I said, the implementation sites as well. Next slide. Yeah. Yeah, so this is again the pictures that shows the sectors that we are targeting, as well as I said, the values and the missions that Save the Children is having. So in this, but as I said earlier as well, this can be in English as well as in Arabic, and we are doing also the Kurdish one because we have areas where people are non-Arab speakers, so it will be much easier for them also to understand that in English, in Kurdish as well. Next slide. Yeah. These are a summary of the locations where Save the Children is currently working, and this is again available on the application. And also, as I explained as well, it explained to beneficiaries what is monitoring, what are the steps of monitoring, how they should do the monitoring on our behalf, and in case they have access to areas that we cannot do. The application as well as record the voices. If the child don't know how to write, then he or she can record the voice and send it to us as well. Next slide. I think that's it. So this is the application that we have currently in ERA country office. Is still at the I will say at the piloting stage, and we will activate the application within the next month to make sure that children and adults in our centers can raise their concerns. What we are also trying to do, because maybe children do not have access to phones or they do not have access to tablets. So what we have done, we have both tablets and phones, and we put them in our centers so children can access them easily, and they can raise their concerns and feedback. Thank you. I am happy to respond to any question or feedback. Okay, so let me see the first one. Okay, be honest on the percentage, I will say it went from 0 to over 30%, where we made these feedbacks turn to actions, and also we made adaptive programming. That was just a one program or one project when we had to do that. It made the process much easier. We were not able, as I said, we were not able to receive any feedback from children. Even in 2021, these 30 feedback, it was because we didn't have a lot of programming during that time. Before 2021, or 2020, we had not a feedback. We've never had a feedback from children. So I think that the orientations and the application will help us a lot. I will not regret to say more than 80%. It will be transferred or moved to action. Our team have taken that seriously, and they are trying to solve all the feedbacks or concerns that are raised from children. Yeah. Could you please tell us if there is any increase in the number of the children feedback after business cards with them? I mean, they were encouraged. Yeah, as I said, to be honest, I was always feeling concerned that whatever we will do, we will not receive any feedback from children. Children, they are not able to say anything. Which now I see like the opposite of that. Um, most of the feedback are raised from children. It might be a very easy feedback. It might be something that we can resolve, but we didn't have them in the past at all. So the business card, actually what we've done also with the business card, it's not, we have not only handed over to them, but we also explained to them as well. We try to make sure that if the children cannot read it, they can understand it and they can raise their feedback and concern. Usually, or in the past, our practice was giving these business cards only to adults. We thought that only adults can raise concerns and feedbacks, which as I said, it's completely the opposite. Okay, let me look at the third one. Sorry. Thank you for, yeah, thank you, Fernanda. I forgot to mention that, yes, we have a dashboard, and that dashboard will define and explains the types of the complaints that we have received in, for example, in the last month, the number of the feedbacks, the categorization of these feedbacks. It gives you the automatic analysis of all that. It also explains whether the complaint or the feedback have been raised from child or adults, the solutions and the actions that have been taken by the program team or by us. So all of that is done through the system, the mobile phone application. I have not showed that dashboard as we are still in the stage of the finalizing and also activating the application on for iOS and Android as well. So it might be activated and happening within the next month. Yeah. So do you think that you could use the tool to start ask children and communities why the to be honest, I will not think now at the current stage, not, but maybe for the future, yes. Our concern so far is just making sure that the community is aware of the system and able to raise their concerns and feedback. It was one of the red flags which we kept having for a couple of years, and now we are in the first stage to address that and having their feedback, which was not happening in the past, I will say. Okay, so in terms of the consent, thank you for raising that. For consent, we usually, for our centers, any child access the center has to sign the consent form. The consent form for everything, for taking pictures, for raising their feedback or concerns, it's for their participation as well. So it's already included in the consent form that we have, but a separate one for this one, no. We have not made a separate one for this. I do think, yes, it can be a good idea, and it's something that we need also maybe to take into consideration, because it's one of the things that, to be honest, we have never thought about it. But I will see if we can do that and incorporate that in the system as well. So we may try to find a way where the parents can also maybe do that electronically, and they can receive a message on their phones, so they can give their consent. But as I said, the consent forms are filled out before for children and for adults before accessing any type of activities that Save the Children is running. Okay, I think these are the same ones that I have responded. Okay, thanks, Bian. Speaking of accessibility related challenges, what are your recommendations to increase accessibility when working with children of younger ages, country then right, children living in remote areas, and that's living with disabilities? Um, we've thought about disabilities. That's why we said, in case maybe it's not all the types of disabilities, but at least the ones who cannot, I will say, who cannot uh, speak up, or who they cannot speak, they at least they can write. And for those who cannot read and write, they can type down their messages. This is the only, I will say, these are the only two categories that we thought about, and we said let us consider them. As for the other types, to be honest, so far we still trying to solve that, but nothing's made to solve the other types of disability people, and how we make sure that the other types of peoples or disabilities are considered, and they can also reach out to us in case they have concern or feedback. To be honest, the number of cases that we receive through the complaints have reduced a lot. Comparing the past, where we had only the complaint boxes to receive children feedbacks or adult feedbacks, is much less than the now. Especially before even establishing the system, we had a hotline or toll-free line, and people found that much easier for them to raise their concerns through the phones rather than the complaint boxes. I will say maybe 20 or 15% of the feedbacks we receive through the country office, it's only 15% out of the total number of the cases that we receive on monthly basis, or maybe it can be also less than the 15%. Okay, but let me see the other part of it. Do you have already figures as how much feedback is coming from the app? Yeah, as I said, that the application is still at the piloting stage. To be honest, we have not received yet, but we made all the steps ready to start to make sure that the system is functioning from next month. But for the facilitators, as I said, that through the facilitators one, in the previous years, 2 years, I will say in 2020 and 2021, we received only 30 feedbacks from children. While in August 2022, in 1 month, we were able to receive 53 cases. So you can see the difference. In 2 years, only 30 feedbacks, while in 1 month, after the facilitation or after the sessions that have been given by the facilitator, there have been a huge improvement in number of cases that we are receiving. Yes. Okay. I can send a brief on the technical aspect of this application. I will share it with Ayan, so he can share with all participants, so you can maybe adapt and contextualize and use in your country if you want. The system, I think it's the first system to be used in Iraq, and it has not been used by any of the local or international organization that are currently working in Iraq. So we are the first one, and we are hoping that the system is really will have a positive impact on children and also improve the accountability mechanisms for children as well as adults. Um, um, to be honest, no, I don't have. Even our idea, it took us a very long time until we really implemented. We've been thinking about it for the last 4-5 years until out of sudden we've decided, after we have received the encouragement from our country director, to come up with an innovative idea and make sure that children are raising their confidence. So we said, we have this idea, but we don't know how to start the process. So we have received the encouragement from our country director, and we started designing the system. So it can be finished. It depends on the capacity that you have in your country office and how many staff will be dedicated to finalize the system and the application. For us, because we don't have dedicated for this one, so it took us around 6 months to complete. But I think if you have a dedicated staff for this one, then I'm sure you will finish it in less than 6 months. Sorry, we have electricity issues always.
Almost perfect timing there, Vian. Okay. We are now just on 1 o'clock European time, so it's time to wrap this one up, if that is okay.
Okay.
Do you have any final notes?
We still have other questions. I will try to respond to them. I will take a screenshot of these questions and I will send the response to you, Ian, so you can reach out to participants. As well as I promised, I will send the technical aspects of the of this application so participants can use in their country offices. I want to take the opportunity and thank you all for your active participation and raising your questions and feedbacks. Thank you a lot.